Hello, and welcome to this Google Hangout today with Girls Globe. Um, we are meeting today, and it's Mother's Day in many countries around the world, and we wanted to get together to celebrate mothers and the very important caregivers to mothers and newborns, midwives. So today we will be speaking about the status of maternal health, access to sexual and reproductive health services, and the role that midwives play around the world, all from the perspectives of young women from various countries. Girls Globe is a global network of young women bloggers who are passionate about the rights and health of women and girls. And I'm thrilled to be joined by some amazing women today, and I'll ask them to introduce themselves individually. We can start off with Emma.
Sure. So my name is Emma Salaranta, and I'm the communications director and blogger for Girls Globe. And I'm a native of Finland, currently living in the United States in Brooklyn. And I'm also currently pregnant with my first child, who's due to arrive in October. So even though I've been passionate about maternal issues and maternal and child health for a long time, now it's taken on a whole new character because of my personal experience of going through this journey and seeing the system in a very different light now that I'm actually in it myself. So I'm very excited to be here with these amazing girls today. And I'm 29 years old.
Great, thank you, Emma. Farah.
I'm Farah. I'm from Jamaica. I'm a journalist. I'm 24, and when it comes to maternal health, I'm recently moved to the U.S. and I've started to realize that this is a huge deal, even in the first world. I've always been passionate about women's rights, but now, especially because my friends are getting pregnant, it's becoming more and more apparent how important it is, and that it's not as easy as I thought it was going to be. So that's me.
Yeah, and for us, you're also a Jamaican national.
Yes.
So you've moved to the US to study from Jamaica. And over to June. Tell us about yourself.
Hi, I'm June and I'm 15 and currently in secondary school in the UK. I'm originally from Nigeria and I do go back there quite often. I blog for Girls Globe as well, and I'm an FGM ambassador for Plan International and on the youth advisory panel for Plan UK. And I think maternal health is important because when I volunteered at the midwifery kind of centre in Lagos, I really realised how difficult it is for mothers to have to go through such a process when there's no resources or funding available.
Amazing, thank you. And my name is Julia Wicklander. I'm 27 years old, and I'm a global citizen from Sweden. I'm the founder of Girls Globe, and so I'm really so thrilled to be connected with all of these inspiring young women who are leaders and agents of change in their communities in various places around the world. We were supposed to also be joined by Nelly Lukale today, who's a Girls Globe blogger from Kenya. And Nelly is a community health nurse and a national youth coordinator for YWCA Kenya. She's a strong advocate for sexual and reproductive health and rights, and as well as girls' education. But since she's out in a village with very bad internet connectivity, she's not able to join us today. But she has passed along a few of her responses and views, so I will be adding her voice to this conversation as we go along to get a young woman's perspective from Kenya as well. So let's start the conversation on midwives. Emma, you're from Finland, and in the new State of the World's Mothers report that was released by Save the Children earlier this week, Finland was ranked #1 in the world. The best and the safest place for mothers and children. Could you give us some insight as to why Finland is able to be at the top of the index?
Sure. So, like you mentioned, Finland ranked #1, and Finland ranked #1 last year too, and I think in a few previous years as well, and which obviously is great, and I'm very proud of my country for that. And I think a big reason for ranking #1, first of all, is the accessibility of the system, and the fact that in Finland, healthcare system is fully public and free, which means that every single mother and child has access to the same services and same quality of services, not depending on where they live or what their income is or what their economic status is. which makes it a very equal system. So I think that's a huge thing. And then the other thing with the index, for example, is that if I remember correctly, Finland doesn't actually rank number one. Like the index is comprised of different things that they measure. And Finland doesn't necessarily rank number one on each individual indicator, but on a whole, Finland consistently ranks very high on all of them, whereas other countries have a huge disparity between how they rank on those different indexes that, say, the children uses to come up with the kind of state of the mother's index altogether. So that means that all the parts of the system are working well. It's not just that, we have low child and maternal mortality, but we also have very good pre- and postnatal care. We have very good informational services. We have very good access to all sorts of additional supportive services for mothers and children throughout the pregnancy and throughout childbirth and even postpartum. And I think that system as a whole is what kind of results in this very coherent, very holistic way of looking at pregnancy, childbirth, and maternity. And I think the fact that it really doesn't matter who you are and where you are in Finland. You're going to have a safe childbirth and you're going to have a safe pregnancy. And I think the accessibility is one big, huge part of it.
Definitely, and I think I'm from Sweden myself, with your neighbor. So, and Sweden was ranked number 3, and similar to Finland, Sweden also offers maternity and paternity leave from work and many other things that also are related to gender equality in society in general, which does of course have an impact on the health of women and children. And Emma, I was going to continue and ask you what role midwives have in Finland and how midwives actually play a part in that high level of maternity care that is available and accessible in Finland.
Sure. So we have a part of the public healthcare system that in English is often called maternity clinics, which is a whole separate part of the system that is specifically designed for family maternal health services. So it basically targets women who are pregnant, women who are going into labor, and then families with small children. And that part of the healthcare system is more or less run by nurses and or midwives. So in Finland, the role of an OBGYN throughout pregnancy and childbirth is actually fairly minimal, unless it's a high-risk pregnancy. Otherwise, once you get pregnant, you enter the kind of maternity clinic system. All of your prepartum and postpartum visits are within that system, and that system is what takes care of you and provides you with the information and the checkups. And only if there's an issue that requires an OB or a doctor, an OB or a doctor is brought in. So most of your pregnancy is fully handled by nurses and midwives, because most pregnancies don't require a doctor. There's not a whole lot that midwives can't do, with the exception of, for example, surgery. So if you need a C-section or something like that, then it's a different story. But if it's a normal low-risk pregnancy, then most women don't necessarily need to see a doctor at least more than once or twice. So midwives and nurses really run the system in Finland. So they play a humongous role. And your delivery is handled usually in the hospital solely by a midwife. A doctor will pop in to check on you and make sure that everything's okay and make sure that there's no need for a doctor. And if everything looks good, then the whole thing is handled by a midwife. So it's a very midwife-driven system in Finland for the whole process of pregnancy and childbirth, and also postpartum, because we get postpartum support after you've delivered your baby and you go home. The same maternity clinic system offers home visits postpartum, which are also conducted by nurse midwives and nurses who work in that system. So they have a huge role to play.
Thank you, Emma. And we're going to move to Nigeria, and I'm going to ask June a little bit more about her home country. And Nigeria was ranked in the new State of the World's Mothers Report as one of the 10 countries in the bottom of the list. In Nigeria, there's a 1 in 29. There's a lifetime risk of maternal death. That is 1 in 29 women. So Nigeria and India also make up 40% of the world's maternal deaths, which is a huge problem. So, June, could you tell us a little bit about what you think are the underlying problems to these high levels of maternal mortality in Nigeria, and what do you think is needed to address this problem?
Yeah, so I think in Nigeria one of the big issues is funding and resources, and the fact that the government is meant to give a certain amount of its budget toward health and ensuring that people have access to health. But this isn't necessarily done, and although there are public hospitals, a lot of them are in very, very bad conditions. And there's also a scarcity of doctors, and there are very little midwives available. And if I don't exactly know the statistics, but I'm pretty sure that there are very few doctors per 1,000 people. And there's also this kind of fear of going to hospitals. I know that my nanny sister needed to have a C-section and she completely refused because she was scared. And so there are a lot of women who believe that it is better off for them to stay at home and have their babies by themselves because it makes them stronger in some way. And of course, when there are complications and they can't handle these by themselves, which then leads to a very high maternal death rate. And also, hospitals are expensive. The vast majority of people can't afford them. A lot of public hospitals will charge you to even just register. Doctors will refuse to see you if you can't pay this. So there's a lot of different issues to it, funding, and there's no access to medication. Transport systems are poor, and so even if a hospital needed, I don't know, resources or medication or anything, it would take a very, very long time for these things to reach where they're most needed. And so, in return, then there are very high levels of death in childbirth. And I think what the country needs to do is to try and get a lot more midwives and doctors because they're not readily available, and try and kind of remove this kind of stereotype that you having your baby at home is the best thing to do, because it's not, and trying to encourage people to go for hospital checks and antenatal care and all those very, very vital things that a lot of women just simply ignore during their pregnancy.
Thank you, June. And what do you think? What role do you think midwives have to increase both accessibility for women, and what role do midwives play in increasing these health standards in Nigeria?
Well, I think the best thing about midwives is that they're very mobile in the sense that they can go from different communities and go to women, because some women are just against hospitals for various reasons, and so they feel a lot safer if a midwife comes to their home, and then they build relationships with their midwives. So I think midwives are important in the sense that they can go into communities that are very rural and provide the healthcare and what the women need, as well as educating young girls about sexual and reproductive health, which is not done in a lot of Nigerian schools as well. And yeah, I think probably that's the best thing about midwives.
Thank you. Yeah, I think education and sexual and reproductive health and education around family planning is, of course, a crucial aspect in improving the health standards for women and newborns in Nigeria. You spoke a little bit about the fear that women have to actually seek help and go to hospitals when they need, and not even go to hospitals for their deliveries. What do you think that fear is about? What are women afraid of?
I think women are afraid of the system because a lot of women prefer having traditional birth attendants. That's what they've seen, and that's what they're most comfortable with. So I think they're not they're afraid of hospitals in the sense that it's kind of like I don't really know how to describe it, but how it's set out, and I think that's probably what they're scared of. And I really don't know actually why people are scared of hospitals, if I'm completely honest. But I think it's probably to do with how it's set out and how distant everything is, and how the lack of resources. I think most women would probably say I'd rather die at home because if I go to a hospital I'm going to die anyways, because there's nothing in the hospital. So I think they're scared that the doctors can't really offer them what they need.
So do you think that there is a lack of understanding and a lack of education around why midwives are so important? Educated and well-resourced midwives are important, rather than using traditional birth attendants who use traditional methods that are in many ways not helpful for the lives and survival of women and newborns. Do you think that there is an education gap?
Yeah, I definitely do think that education is important. And I think across many different sectors in Nigeria, the people need to be educated about why healthcare is important and why midwives make a difference. And I think with time and with proper, visiting communities and midwives, more people becoming midwives, I think then this could be potentially be eradicated.
Thank you, June. So let's move to the Caribbean and move to Farah. You're from Jamaica, and Jamaica was ranked 91. So it's a little bit in the middle of the whole list of from the State of the World's Mothers report. The country has fallen in rankings in the past few years, although the lifetime risk of maternal mortality remains pretty much unchanged since the last decade, and it's 1 in 370 women who risk dying in pregnancy or childbirth. In your experience, and from your experience in Jamaica, why do you think Jamaica has been standing still for the past decade?
That's a really good question. Although I think our rate is pretty okay in terms of world standings, especially for a third world country, it's true we're having serious trouble tackling that last bit in maternal mortality. I don't think the issue is in our healthcare, because in my experience, many women in Jamaica luckily do have access to quality healthcare, thank goodness. But I do think part of it is economic. Like many countries, Jamaica has been struggling since the Great Recession, and we have been diverting our resources in all sorts of ways, and unfortunately health does get affected, and women's health in particular is not seen as a priority. And according to reports, the maternal mortality rate we do have is affected by a number of things, and very few of them are direct, so it's very few things you can say this is affecting it or this is affecting it. Although one of the things that is affecting it, I do believe, is abortions are still illegal in Jamaica. Except in cases of medical emergencies, which is, I think, a situation that needs to be revisited by the government. But of the indirect factors, I think a lot of these are rooted in greater issues of inequality in terms of financial status, with women living in poor communities suffering the most from maternal mortality. And as an extension of that violence against women, how we perceive women in the Caribbean, how we treat them, their status, this is a problem we've been struggling with for a long time, and it's obviously reflected in our mothers and the health of our mothers. And this is not something that can be solved even if Jamaica does increase its financial status. I think this has to be resolved by education, by a change in attitude, by really addressing significant issues within our culture, which may take a long time.
Thanks, Farah. And I'm so glad that you mentioned all of the indirect factors as well, and just the levels of gender inequality and violence against women, and how all of these things are related to women's empowerment, and of course related to women's and children's health. So of course, you also spoke about abortions being illegal, and I'm just wondering about the accessibility to family planning services and contraception and other sexual and reproductive health services. Are those readily available in Jamaica?
I have to say, they're available. I don't know how readily they are to the people that need them most, and I don't know what the education is like for those people in particular, which is, it's great for the middle class to be able to have this fantastic family planning services, but when you're talking about communities that are having too many children to support them, this is where we really need to be going. So I think the access is there. I don't think it's exactly there where it needs to be.
Yeah, and I think that that's often the case, that we look at these numbers and we look at countries as a whole, and that is just something we can't do, because except for countries like Finland and Sweden, which have a small population and have services available in all areas. I mean, many countries are very different depending on where you are. So are you in rural versus urban, or are you looking at a certain region of the country, or is it the slum areas in the cities? Or so there are so many inequalities that can be in a country. So that is why it's so important for us to look at a country a little bit more diverse as well. So for what role do midwives play in Jamaica? You said that health is pretty much available for most people. So are midwives seen as an important part of maternity care?
Yeah, they are, and I'm grateful for that. Luckily, midwifery is very respected here. Perhaps not as much as medicine. You're far more likely to hear a young person say they want to be a doctor rather than a midwife. But that being said, in my experience, it's accepted that midwives are masters of the delivery domain. Do I think there are enough of them? No, I wouldn't call it a dying art. That would be exaggeration, but I do think it needs to be more promoted, especially among young people. I think we're going to run into a shortage very shortly. And I think also people may not understand that they're not just there for delivery. They are specialists in aftercare and prenatal care as well. So, yeah, I think they're really respected. I think we have to keep working on maintaining that level of respect.
Yeah. Thank you. We need more midwives, and that is really the case not only in Jamaica but around the world. As we see it, the UN estimates that about 350,000 midwives are needed to create universal access to midwifery services. So, of course, there is a shortage, and what is also leading to that shortage is also the maybe disrespect that midwives meet sometimes, and also the hierarchy within the healthcare sector, also between doctors and midwives, and that's something that we also have to advocate against, because midwives play such an important role. And so I also asked Nelly, who was not able to join us today, about Kenya, and Kenya is ranked 143 in the new report from Save the Children, and she says that the government in Kenya really needs to address all the challenges that are linked to ensuring availability of adequate maternity services and skilled personnel to attend to complications caused by unsafe and induced abortion, as well as HIV and AIDS. She says that the current AIDS prevention and treatment programs need to be sustained and expanded, not only in Kenya but in all countries, and that governments need to offer training to traditional birth attendants, as we spoke about in Nigeria as well, that these traditional birth attendants need to have the training that is really needed to be able to address the health issues for women, especially in rural areas. Nelly also says that it's incredibly important to have access to skilled attendants at delivery, emergency obstetric and post-abortion care, and then also functional referral systems that need to be both available and improved throughout the country. She also says that access to sexual and reproductive health services should be available to every woman, whether she is young or old. And in Africa, most young women still face a lot of discrimination in accessing these services, like family planning. And many safe spaces need to be created so that young women feel safe and are free to access the services that they need. And they need to ensure their privacy and confidentiality when seeking these services. And she says that these services and having these safe spaces will help them to, especially of knowing more about the dangers of early pregnancy, unsafe abortion, contraceptive, and also the importance of contraceptive use, and also as well as reproductive cancer screenings. And she says that comprehensive sexuality education should be introduced in schools, and that this education and curriculum needs to be taught to teachers to be able to speak about it at hand to the young women, but also the men and boys who are attending school. So if we go to a little bit of a broader perspective and move from the country-specific data and that we've looked at and the problems within the countries, I would like to ask the three of you what you think, why midwives matter specifically to young women around the world. Farah, would you like to go ahead?
Sure, yeah. Well, for me in particular, I think as a young woman who hopes to have children one day, not quite there yet, but childbirth is getting really over-medicalized, and especially in my country, doctors can be overburdened, and you may not get the care or attention that you want, or a specific birth merits unless you're in trouble. And I think midwives really rectify that in a lot of ways, and they have a lot of wisdom and a lot of experience where, as again, although I have so much respect for medicine, they're stretched across a wider board of knowledge. I don't know how to say that, but to have people who really spend their entire lives doing this day in, day out and know what's coming and what to tell you, that's a great comfort, just coming from a personal perspective, and I think a lot of women would feel that way.
Thank you, Farah. And I wanted to ask you as well, have you yourself been in touch with the midwife, and how was that experience, if you have?
I have not had the pleasure, no. I have had much contact with medical students and doctors who are grateful for their existence, but no midwives themselves.
All right, thanks. We look forward to hearing about it once you have. June, I want to move to you as well and ask you what you think, why you think midwives matter to young women, and also if you've had an experience meeting a midwife, and tell us about that experience.
Yeah, so I think midwives matter to young women because I think they're probably the best way for women going through pregnancy to get the care and the support that they need, because often, like Farah said, doctors are quite busy and don't have the time. And so I think apart from being able to give this care and that pregnant women need, I also think midwives are important in delivering kind of family planning services, educating women in different communities about family planning, about sexual and reproductive health, educating young girls. I know in a lot of schools in Nigeria and across South Africa as well, a lot of midwives do go into schools to provide sexual health kind of lessons. It's not popular, but it's something that is growing, especially in Nigeria. And I think midwives also kind of offer a sense of like confidentiality between a woman and her midwives, and they kind of build a relationship, and most women do, I think, trust their midwives. I don't know. And have I met a midwife? Last summer I spent 2 days in a hospital close to where I live, and yes, I did meet with midwives and I did work with them. I don't want to be a midwife, but I did think it'd be an interesting thing to do, and I do think they're probably don't get the respect that they deserve for the work that they do on a daily basis, because they have very hectic schedules, and they do try and give as much support to each and every woman that they're seeing and treat all their patients with all the care and the love. And so I think they're important in that sense as well.
Thank you, June, and thanks for sharing that experience. I think that both of you have really mentioned how midwives are so important prior to wanting to become pregnant, and then also during pregnancy for young women and women in all ages, and then also post-delivery. So midwives really play such an important role for women's health. And my first conversation about besides the sexual education that I received in school, my first personal conversation about contraceptives was with midwives in Sweden. So I know that for me, they've definitely played an important role, just to learn more about myself and my body. So I want to move to Emma as well, and I have a few other questions for you, because Emma, you're expecting your first baby, and you're in the United States. So how do you think your experience with maternal and prenatal care in the US differs from if you be an expectant mother in Finland?
It's probably very different. I've obviously never gone through the Finnish kind of maternity system personally myself, because as you said, this is my first child that I'm expecting right now. But I have a lot of good friends, and most recently my younger sister who just had a baby in February in Finland. So I'm very intimately familiar with the system and how it works. And I think, I mean, the one thing that's hugely different about the United States versus Finland is the issue of accessibility. And U.S. has fallen on the rank on the index of the State of the World's Mothers Report of Save the Children, and it's right now, I think, number 31, and it's fallen in the past decade quite notably. U.S. is also one of the very few countries in the world where maternal mortality rate is actually increasing right now, which is pretty horrible and remarkable considering that U.S. is one of the richest countries in the world. So it's obviously not a question of resources. It's a question of accessibility and inequality in terms of women's access to these services. And I think for me, I mean, I'm lucky. I have good health insurance, so I have access to good services. And I think that's the thing in the U.S. is that if you have money and if you are well off, then you'll be fine. You have access to information. You have access to hospitals. You have access to midwives. You have access to doulas. You can tailor your whole experience to your liking and to your needs. But if you don't have that money, and if you are a low-income mother and, you know, mother who's maybe working more than one job and really does not have the time nor the energy nor the ability to try to maneuver the system, work through it, and find the information that you need, it can be really hard. Because even for me, trying to get reliable information about the cost of things, number one, what I actually need to get done, what is, you know, for my actual benefit or my child's benefit, and what is just a way to kind of milk more money out of me, it's really challenging. And it's also really frustrating because as a mother-to-be, of course you want the best for your child and you want to offer the best care, but at the same time, I also think that not only in the United States, in many other countries too, the whole business of maternal care and childbirth is becoming highly medicalized. And if you look at, for example, C-section rates across hospitals in the US, let's say you take New York, the variation is so big that it's not explained only by need for C-section. Some hospitals just do much more C-sections than others, and it's not just explained by the fact that in that hospital you have more high-risk women. It's that some hospitals just like to do C-sections more. And these kinds of things are really scary, and they're hard to figure out. And when you're pregnant yourself and you're going through this amazing experience and journey, which is wonderful and incredible, but it's also scary, you don't want to have to worry about an unnecessary C-section, or if you're, you know, you have an OB or a doctor who likes to wield the knife a little bit too enthusiastically, that's not a thing that you should have to be thinking about. So I think in the US, while you have probably the best maternal care in the world available to you, it's only available to you if you are of a certain economic class and if you live in certain areas. That's the other thing. There's a huge disparity between where you live, not only on the state level, but even within cities, depending on the neighborhood. So it's a very unequal system, and I think that's one of the biggest problems and challenges in the US. And it's a complicated system, and it's a system that's hard to figure out and hard to kind of feel ownership over. And I think that for me so far has been, I've been lucky. I found a great OB, I have a good doula, and I have a hospital that has a birthing center that's very kind of pro non-medical births and natural births. So, but I live in New York and I have access to these things, but millions of mothers in this country don't. So I think that disparity is a huge challenge in the US.
Thank you, Emma. Thanks for sharing those insights as well. Also, many of them are firsthand for you in this situation as well. So, thank you. And And I also asked Nellie why midwives matter for young women in Kenya. And she said that midwives are easily approachable for young women as they offer so much information, especially to adolescent girls. And she said that they help young women understand their reproductive health and why it's important to do proper child spacing, and also advice on contraceptive use. So in Kenya, young women still have a challenge in accessing sexual and reproductive health services. And because midwives are few and overwhelmed by the large number of patients, they offer little help to young women at times. And then also due to cultural beliefs where sex is only for marriage, there's a lot of discrimination to young unmarried women who seek sexual and reproductive health services, and especially family planning. And this has resulted in a high rate of unsafe abortion and teenage pregnancies in Kenya, which Nellie has also written a blog post about on Girls Globe. So if you want to learn more about that, please have a look at that post by Nellie Lukale. And Emma, I want to ask you as well, why do you think midwives matter for young women?
I think midwives, compared to many other medical professionals, first of all, are more low threshold entryway to learning about sexual and reproductive health and maternal health issues and pregnancy and childbirth. And personally, I think that equally as important as it is to ensure that women experience safe pregnancies and safe deliveries and have support postpartum, is also to ensure, and this is particularly important for youth, that women and men have the knowledge and skills to avoid getting pregnant until they're ready. And I think that's a huge part that midwives can help in, is promoting and advocating this kind of information about sexual and reproductive health and education, not only about, if you do get pregnant, this is where you get help, but how you can avoid getting pregnant, and if you don't want to get pregnant, how you can control your fertility, because making sure that mothers are healthy during pregnancy largely depends on also making sure that mothers get pregnant when they want to get pregnant and not when they don't. And I think that's a huge piece of the puzzle that's missing in a lot of countries, and this information might be provided by teachers and educators in the school system that are not necessarily trained to really provide this information, and midwives could, and nurse midwives could. And I think a lot of young people especially aren't necessarily aware of the role of midwives, and they don't know what midwives do, and midwives are only seen as a person who's there for the birth, but their role is so much bigger and it starts so much earlier. So I think kind of raising more awareness about the fact that midwives have a much bigger role to play than just being the birth assistant is a huge deal, and it can be a much easier way for young people to approach a person than going to a doctor or going to an OBGYN, which can be very scary, and it can be inaccessible, it can be more expensive in many cases. So I think the accessibility part of midwives is huge. And it also provides the opportunity to ensure that girls and boys and young men and women know where to go if they do get pregnant, what options they have available, that there's people to help them who are really only there to help them, and that's their only motivation. So I think for me that's a huge part of the importance of midwives.
Thank you, Emma. And I think what you said as well about the importance of midwives for men and boys is also incredibly important not to forget, because it takes two to make a baby. So
yes, I didn't make this one alone. I don't think any mother so far has. So I think that's another thing that's often overlooked a bit, even though these are our bodies, and it's a different experience for a mother, but it does take two, and there's always a man involved. So ensuring that boys and men are just as equally informed and know how things work and know how their bodies work and know how women's bodies work is huge.
Yeah.
Maybe we also need more male midwives. I don't know how many there are, but maybe we need to promote that too.
Definitely. So in conclusion, midwives play such an important role for young women and young people and people in general around the world, both prior to, during, and after pregnancy. And midwives save lives of women and children all around the world, from Finland to Jamaica, from the US to Kenya. And and midwives play an incredibly important role for young people's access to family planning and other sexual and reproductive health services and information. Yet in so many countries, midwives are rare and midwives are undervalued. And what I said before as well is that the UN estimates that 350,000 midwives are needed to create universal access to essential maternal and prenatal health care. So the world definitely needs more midwives, and we need to advocate for more midwives that have the resources they need and the education they need to continue doing the life-saving work that they do. At the International Confederation of Midwives Global Congress that is coming up in early June this year, the UN Population Fund, UNFPA, and partners will be releasing the second ever State of the World's Midwifery report. This report will have new data on availability, accessibility, acceptability, and quality of midwifery services around the world. You can already today learn more about the importance of midwives by going to SOMI. Let's see if you can see that. SOMI.org, State of the World's Midwifery. And you can follow the conversation about the report using the hashtag SOWMY, SOMI 2014. So as we end this conversation on the importance of midwives, and as we see that midwives are so important and we need to continue advocating, I would like to ask all of our amazing young women on the panel today, what do you think listeners can do to help spread the word and advocate for the importance of midwives? Farah, let's start with you.
Same thing, our amazing listeners and readers always do. Just keep yourselves informed, keep the word out, encourage the people you know to respect midwives, use midwives, let them know that they are not an antiquated position and they have a very real role in our lives today. I know for my part, I have a ton of girl cousins and nieces who are growing up and thinking about going into medicine or into health, and I'm presenting this as an option, which often it isn't for them because they just don't know about it, but the more they learn about it, the more it becomes, it's not only necessary, which a lot of positions in medicine aren't anymore because they're overflooded, but it's good work, and it's sorely needed, and it's scientific, and yeah, I would say that's what we can do to keep propagating midwives.
Thank you, Farah. Emma, what would you say?
Well, very along the lines with Farah, of course, like being informed and advocating and raising awareness in your own community is a huge thing, but I think also, being active and first of all finding out what is the status of availability of midwives where you are. Are they available? Are they accessible? Are there enough of them? If not, then lobbying about this with your local decision makers and politicians. In the U.S. right now, for example, and it took a while, but now, according to the healthcare and health insurance law, midwives have to be approved by insurance providers, which is a huge thing. So if for a very long time it was only OB, so if you went to a midwife, your insurance did not have to cover that, and that's a huge thing because if your insurance doesn't cover it, then you're most likely not going to go for a midwife. Because it's going to cost you more. So I think making sure that healthcare plans and healthcare insurances cover midwives and accept midwives and approve midwives services is huge. So being politically active in your own community at community level is big, because for a lot of women, midwives might just not be available. And I think, like Farah kind of mentioned, there's depending on the country, there might be a lot of misunderstanding about the role of midwives and the importance of midwives, and people just assume that they need a doctor, even though you might not. And I think raising awareness and talking about the actual role of midwives and what they do and the kind of training that they go through, and that these are actually hardcore healthcare professionals, is extremely important to ensure that we elevate the status of midwives around the world.
Thank you, Emma. June, what do you think our listeners can do to help advocate for midwives?
So just like Emma and Farah both said, I definitely do think advocating about midwives and spreading the word about their importance is important, and often I also think it's imperative. But I also think young people need to put pressure on their governments to ensure that midwifery and healthcare services aren't left out, especially for young women and men and boys. And just as a lot of young people are putting pressure on their governments to think about things like FGM and child early and forced marriage, I do think that a lot of young people also need to consider midwifery services and maternal health and child mortality, because although it might not affect us now because we're quite young, I definitely do think in years to come it will be an important issue that we need to tackle before we get there.
Definitely. Thank you so much, and thanks to all of you for your insights. And I think that there are so many ways that people can get involved. And Farah, I liked what you mentioned, that you try to sneak in the importance of midwives when you have friends who are trying to figure out what they're supposed to do with their lives. And that's sort of what I do when I speak in Swedish schools about maternal health and development and women in development, is that the most important job that you can actually do today is become a midwife and train others to become midwives, because that is really what is going to improve the status of women. If we can ensure that women and girls become pregnant when they want to, and ensure that their rights are fulfilled and that they are healthy, we will really, really raise the potential of the world's population, and this world will be both a better place to live in and a more peaceful place to live in. And of course, we need to, as June mentioned, look at issues like child marriage, because that is, of course, a big problematic for young girls, and often child marriage is linked to early pregnancies. So that is definitely something to continue to advocate for. Some practical things that you can do, of course, to learn more. At Girls Globe, we're currently highlighting the importance of improving maternal and newborn health around the world, and also the positive change that is being made. And we want to encourage you to join that conversation too throughout social media. So you can go to Girls Globe, our blog, and read more and learn more about it, but you can also become active throughout social media. So right now we're spreading the word about the importance of women's health, and something you can do on Instagram or share through a picture on Twitter is to just take a picture of yourself with a heart-shaped, your hands making a heart shape. A very simple image, and you can just write why you think it's important to stand up for women's health. Please share your image with us, and we'll be happy to spread it along and just raise our voices together and unify them for women and newborns around the world. And something else is that Girls Globe will be present at the World Midwives Congress in Prague in early June, and throughout May, the remaining of this month, and during the Congress, you can follow the conversation on social media using the hashtag ICMLive. And that will give you updates both about midwifery, about maternal health, and also live coverage from the conference. Many of you are not able to attend, but it is an amazing global conference with leaders and change makers from around the world attending, and Girls Globe will be there to make it accessible for you as well. So together, let's just create a storm of advocacy about the important work that midwives do to improve and save the lives of mothers, children, and families everywhere. Thank you so much to our amazing panelists today, and thank you all for listening in and joining the conversation.
And happy Mother's Day.
Happy Mother's Day.
Thank you.